Hello, this is Dr. Cronk with Spinal Kinetics, and what I want to talk about today is how a CRMA assists the doctor with showing that the patient has future care needs. So there's two types of care. There's maintenance care. Maintenance care is care that's delivered to a person that doesn't have any problem. They're trying to maintain their health, and they don't have a condition. They're trying to avoid something that they don't have. Supportive care is very different. Supportive care is, if you take a diabetic, insulin is supportive care for the diabetic. They can't really do without it. They regress significantly into other conditions if they don't have it. Musculoskeletal conditions are no different. Supportive care is care that's basically therapeutically necessary for a person to maintain their gains that they've had in any sort of therapeutic interventions. So some people will require future care, supportive care. Now, all supportive care is based on the injuries, and the injuries themselves are what CRMA assists with, specifically the spinal ligament injury. The spinal ligament injury is the most significant injury that any spine can have. Remember, the spine only has two parts to it, so it's just bone and connective tissue. The two connective tissue bioimaging markers are excessive motion for non-disc ligament damage and MRI or disc herniations for the disc condition. So when a person actually has a spinal instability, if you just today, right now, if you wanted to go out and just ask ChatGPT, does a spinal instability accelerate spinal degeneration? And of course, it's going to tell you absolutely yes. I mean, I don't think there's anybody out there that doesn't believe or doesn't know, or if you don't understand this, I don't know that you should be treating spinal injuries. Spinal instability accelerates spinal degeneration. Now, patients are all different. The injuries are the same. So if you burn a person that's overweight and you burn a person that's underweight and you burn a person that's malnourished, the burns are the same. But the condition of the body which has the burn can be all different. It's no different with a spinal ligament injury. The ligament injury itself, just like a disc herniation, you say a disc herniation, you could have a different person that has a disc herniation has a completely different response to the disc herniation. It's no different with the spinal instability or spinal non-disc ligament injuries. You have to clinically correlate to the x-ray or to the imaging study and what you see in clinic, as well as what is the condition of a person's body. And that's what determines, the combination of those three is what determines future care needs. But how a CRMA assists you with that is it shows how damaged the non-disc ligaments are. It shows you how much spinal instability you have. It shows you do have a surgical level of spinal instability, even though you've been able to stabilize it and you're supporting the person so they're avoiding a surgery. That's what the CRMA does. So the CRMA itself, again, helps to show the significance of the non-disc ligament injury, and those injuries cause spinal instability, and that spinal instability, depending on the patient, oftentimes needs future care. And so the imaging study with the other parameters I've listed are what assist you with being able to determine that, justify it, and make it so anybody else, a reviewer, an insurer, or anybody else looking over your shoulder goes, okay, I agree with that. The consensus says that that's true. That's where you want to be. You want to be with consensus and guidelines. And that's what the consensus says about this condition.